Yes, my name is John Grant. I'm 77 years old, retired physician, and a CT scan was done at that time showing spinal stenosis, severe. Pain became so severe and limited my movement that I had to use a walker to get around, and even that, using the walker, I had to stop every 10 yards or so to relieve the pain. I was essentially incapacitated.
And now you stopped practicing. Is this the reason you stopped practicing?
Yes, it is. I really couldn't practice anymore because of the pain and limitation. Couldn't stand on my feet, which was part of my profession, doing surgery.
Mm-hmm.
And so I had to stop working as a urologist, yes. And because of that, I became very depressed and didn't go out much. Also, I had to use pain medication to the point where I was almost getting addicted to Percocet. So I realized that I needed to do something drastically different.
Right. Did they offer you any other type of treatment, or what did they suggest for you?
Well, they actually suggested that I do surgery, but I did my own research on the surgery recommended, and I realized that the results were no more than 50% cure. And I put cure in quotation marks because I don't think there's ever really a complete cure after surgery.
Mm-hmm.
Also, my weight had gone from 220 pounds to 285, and he insisted correctly that I had to lose weight because that was adding to my difficulties with my back. So I went on a diet and exercise program. The diet has worked out very well. I have lost 90 pounds since I...
And now, last time you were talking to me about you want to go back to work again, or how do you feel about that?
Yes, I have applied for a position, and I would like to work part-time again, yes.
And you feel like you can do it now?
Oh, yes, definitely.
Before you couldn't walk, I remember you were using a walker, and you were trying to go
I used
for
a walker, and graduated from a walker to 2 canes, and I have no use for any canes or walkers anymore. I can walk perfectly well. Yesterday I walked 2 miles, which is usual for me.
And you do that regularly now, don't you?
Yes, I do.
Yeah.
All I can say is the treatment I've received from Dr. Morris and his excellent staff has been magnificent. And I am thoroughly impressed with the professionalism and the care, thoughtful care that they have given me. And I highly recommend his treatment to anybody with a similar condition.